Well, hello, it's Bruce Williams again. It's a beautiful day here in Bethesda, Maryland. I'm stuck inside, sheltering in place. So I think it's a great time for Gross Path Challenge number 58. Are you ready to go? I sure am. So here is slide number one. Slide number one is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up. We're looking at a cross-section of a tubular organ. A little difficult to tell what it is, but if you look at the lumen, you can see that it is lined by a thick, almost cornified mucosal lining. And when you see this, I want you to think about the esophagus. Remember, the esophagus has a very thick mucosa because animals are swallowing large boluses of roughage and feedstuff, so it needs that thick layer. Now, the problem is that there's not much of a lumen here, and then we have a very, very thick band of circumferential muscle here, and this is a condition that is seen in a lot of horses. It is known as distal esophageal hypertrophy, and what we're looking at is massive expansion of the inner concentric muscle layer. And when you add so much of these cells and so many extra cells, and they're so big, you get this sort of whitish look. It doesn't even look like the surrounding longitudinal layer. Now, you'll see this in a lot of horses. Nobody really knows what causes it. And some people treat it as an incidental finding. Some people think it's a pathologic finding. The only time that is proven generally to be a problem is in Frisian horses. There was an article by Dr. Misa Khomeini and Ingeborg Langor back in 2013, which showed that this can be a problem and can be associated with megaesophagus in Frisian horses. There's a study of megaesophagus in warm blood horses a number of years ago that came out of Europe, which didn't show any relationship. Sometimes, very rarely, because of the muscular hypertrophy, you can see pulsion diverticula, where you get a diverticulum, and because of the strong contraction of this muscle, it actually enlarges the diverticulum down into the muscular layer. But for most cases, you can see this. You can also see the distal ileum as well, and it doesn't seem to cause any problem for that particular horse. Slide number two is tissue from a piglet. And I'm going to say that this piglet is less than 7 days old. I need a good morphologic diagnosis and a cause in this. Okay, time's up. We are definitely looking at a very red gut. Williams' rule of red guts is if it's a small animal, it's probably a parvovirus. If it's in a production animal, especially a very young one, it's going to be Clostridium perfringens type C, and that's exactly what it is in this piglet. Clostridium perfringens type C is a disease of the very young animal, neonates to maybe 7 days, absolutely tops, usually somewhere around 2 to 4 days. The big problem with Clostridium perfringens type C is the production of beta toxin. Beta toxin is a trypsin label toxin. So animals that are just born or very young don't have any trypsin in their gut because they're absorbing colostrum, and that would be counterintuitive. You don't want to be digesting the antibodies you're absorbing. But then after about a week, they start to produce trypsin. They are no longer susceptible to this toxin or to this disease. Right now, we're looking at a classic sign of Clostridium perfringens type C. The morphologic diagnosis that I would like for this is a segmental necrohemorrhagic, and the most important part is necrotizing. We see a lot of hemorrhage in this, but the necrosis kills the animal. Necrohemorrhagic enteritis with, see all these little bubbles, with emphysema. It's a classic associated histologic lesion with many different types of Clostridia's gas production. So segmental necrohemorrhagic enteritis with emphysema, Clostridium perfringens type C, and that trypsin label beta toxin is the bad actor. You can see this in small ruminants, large ruminants, even horses. Not too common in horses, but if you see a production animal, with this lesion that's less than a week of age, I'm thinking Clostridium, but you still gotta type those toxins. It's one thing to culture various Clostridium. You're gonna get Clostridium A because you get that from anybody, but or the alpha toxin. You gotta type those toxins. And if you come up with the beta toxin, you have the lesion here, and you culture Clostridium perfringens type C, that's your diagnosis. Slide number 3 is an ox, as you can see. Can you name the disease? And can you give me a good gross lesion and a great histolesion that you're going to find in this animal? Okay, time's up. If you look at this animal, you can see this marked swelling of the brisket. You can see ventral edema here. Some of the legs probably have some edema. And this is a condition that is associated with animals, especially younger animals who are exposed to higher altitudes for the first time. It used to be called brisket disease because of the brisket edema, but now it's referred to as high altitude disease. And when an animal goes from a normal housing at low altitude to high altitude, you'll see a marked difference in the oxygen that's available. And as a result of that, you will get pulmonary vasoconstriction. Sort of counterintuitive, as you would think if there's not much oxygen, you would open up every vessel. But it's a reflex, and in many animal species, with decreased oxygen available, the pulmonary vessels will clamp down, especially the arterioles. And then over time, you will have muscular hypertrophy, fibrosis of the tunica media and the adventitia, which is a great histologic finding. You're not going to see it grossly, but when you section those lungs, you're going to see marked muscular hypertrophy with fibrosis. The gross lesion that you would see, when those vessels clamp down, the heart is beating against increased pressure, and you have pressure overload, so you will have right ventricular hypertrophy and ultimately right ventricular dilatation. As the heart starts to fail, as that right heart fails, you start to get this ventral edema. So great story associated with high altitude disease, great lesions associated with high altitude disease. And if you want to read more about that, it's a fascinating condition. If you look at the Wednesday slide conference number 20, just a couple of weeks ago, you can see that case 3 is all about high altitude disease. So go to www.askjpc.org, look at the Wednesday slide conference 20, case 3. Slide number 4 is tissue from a rat. What a wonderful picture. Can you give me a morphologic diagnosis and name the condition? Okay, time's up. This is a very common problem in older rats, especially if some strains. The Sprague Dawleys get it very commonly, Fisher 344s. And what you see when you look at the kidneys are they're very abnormal color. They're sort of a golden white. They're probably a little bigger than normal. But whenever you see golden color of kidneys in any species, with the exception of cats, which tend to be a little bit more golden because they accumulate fat within certain parts of the nephron. Maybe pigs often are a little bit lighter, not too often. Whenever I see a gold color in any other species, I'm thinking of glomerulonephritis. Morphologic diagnosis is diffuse severe chronic glomerulonephritis, and the condition name is chronic progressive nephropathy of rats. And as animals get older, this probably starts histologically. You can see the first signs, a small basophilia, which is seen throughout the tubules in the kidney. You will see this as early as 3 or 4 months, and it gets progressively worse to incorporate other parts. Remember that the kidney's all tied together. So if you have a lesion that is progressive in either the glomeruli, the tubules, or the interstitium, eventually it's going to spill over to all. And at this stage, the glomeruli are very dilated. The tufts are atrophic. The tubules, many of them are just gone. Some are regenerative, a lot are degenerative, and there's a lot of fibrosis and inflammation. in the interstitium because the kidney's all wrapped up into one big package. So there's a classic lesion. For those of you taking certification exams, I want you to either go to VISPO, or if you have a nice gross lesion, this pops up every couple of years on Wednesday slide, make sure that you describe it. It pops up on certification exams on a regular basis because it is a common lesion in old rats. It is a very descriptive slide, and you want to describe it at least one time before you get to Tampa or Hanover or wherever the European board is given this year. Slide number 5 is tissue from a dog. Can I have a morphologic diagnosis and 3 possible causes? Okay, time's up, and this, we are very up close and personal with the liver of a dog. The condition name is cirrhosis. The morphologic diagnosis, if you ask cirrhosis, what the morphologic diagnosis is for 10 different pathologists, you might get 10 different answers. I don't like cirrhosis as a morphologic diagnosis. My personal morphologic diagnosis is a diffuse macronodular hepatic hyperplasia with necrosis. Okay, you got a couple of things going on here. When you look at the pathogenesis of cirrhosis, it's very simple. You're given a dog, cat, horse, whatever, a small amount of toxin. It is not enough to kill the animal outright, but you give it over a prolonged period of time. And what happens is you kill just little bits of little hepatocytes here, little groups of hepatocytes there. And the animal is able to recover. The liver regenerates very well, but over time, with this constant low-grade insult, doesn't regenerate all that well. When you kill off hepatocytes, 2 things happen. First is that hepatocytes will regenerate. The other thing, unfortunately, is that pluripotent cells in the liver will differentiate into fibroblasts. And so you have a proliferation of fibroblasts, which put down fibrous connective tissue around these proliferating hepatocytes at the same time, and you end up with these small nodules and these relatively large nodules. These large nodules are very characteristic of cirrhosis in dogs and humans, not so much in other species. And when we get to our production animals, horses and ruminants, you tend to have just a sclerosis, a contraction with all this fibrous connective tissue without the formation of these macronodular areas of hyperplasia. Cirrhosis is a very difficult disease often to get a cause on because it's been going on for a long time, and you're not sure if there was an event 5 years ago and then the animal's just been creeping along. It doesn't kill animals. It doesn't cause them to go directly into renal failure. It's a prolonged process. So when you get a liver that is this bad, oftentimes you never figure out what the cause is. But there are some low-grade toxins that we know about, including anticonvulsant therapy, phenytoin, and even phenobarbital will do this over time. You'll often find a sort of glassy appearance to the remaining hepatocytes because they've been taken in this poison. They have proliferation of smooth endoplasmic reticulum. They have this sort of glassy appearance. Other things that can cause it. We've talked about certain drugs. In people, obviously, alcohol is a drug that can cause this. There are other animals that take in alcohol, such as cedar waxwings. I had a friend who had a dog who's, every year the dog would go out in the fall when the crab apples had fallen off the trees, they'd ripen, he'd eat a bunch, he'd come staggering home, and then 5, 6, 7 years later he died with a bad case of cirrhosis. Not sure if that was the cause, but it certainly makes for a nice story. This can be the result of long-term right-sided cardiac insufficiency or biliary obstruction. It's been associated with certain infectious agents down the road, including a canine adenovirus, a paper that came out in the 80s from the University of Georgia. So there's a number of different conditions that can cause this, and it can be a really challenge to get to one. So macronodular hepatic regeneration with necrosis. Some people say post-necrotic scarring. That's good too. Okay, let's move on to slide number 6, and this is another long story. Can you give me a pathogenesis for this lesion in a cat? Okay, pathogenesis usually, in terms of certification, will be 2 things. One, the ultimate lesion, which we have here. On the other side is the cause. and then a couple of important points in between. Now, the cause of this is probably an old cat. We have bilaterally symmetric lingual ulcers. Okay, they're very necrotic on the outside. You can see some red streaks, probably ulcers. Notice how they're pretty much bilaterally symmetrical. And in previous lectures, I have told you it's very important when you see any bilaterally symmetric lesion. I want you to think about metabolic, nutritional, or toxic lesions. Okay, those are the ones that give you bilaterally symmetrical lesions. So my mind is already going there. I know what this thing is. Okay, it is a metabolic problem. This animal is in chronic renal failure, and it is unable to excrete all the urea and nitrogen. There's going to be other things going on with calcium and phosphorus ratios, but this particular lesion is the result of elevated levels of urea nitrogen in the bloodstream due to failing kidneys. Okay, so what happens, you get lots of a very high BUN, and that urea nitrogen will exude out through the vessels in the oral cavity where there is a population of urease splitting bacteria. And they just love that stuff. And they break it down. It causes a significant increase in the pH of the saliva and release of ammonia. These animals will have ammonia smell to their breath. So the pathogenesis starts with chronic renal failure. It moves to elevated or severe azotemia, or elevated urea nitrogen in the blood, exudation into the saliva, breakdown by urease positive bacteria, and production of ammonia. So essentially, what happens is this poor sick cat has a lot of saliva, and this tongue is sitting in a very caustic alkali bath. And so that's why you get lesions on the underside of the tongue. And then finally, lingual ulceration. So there's about 5 important components of that pathogenesis. It's a great story. Eventually coming up, we're going to talk about a different story associated with renal failure, and that is due to a derangement of calcium phosphorus ratios, which causes mineralization within the body. But that has nothing to do with this particular lesion. Okay, slide number 7 is from a canid. This was a dog. It could, and very often it's like a coyote or a fox. Can you give me a morphologic diagnosis and the cause? Okay, time's up. This is a classic parasitic lesion. This is associated with Crenosoma vulpis in a variety of dogs and wild canids. And each of these is a granuloma. It is filled with 3rd or 4th stage larva of this parasite. This is a very common location at the distal trachea and the carina, or the bifurcation of the large airways. You see these granulomas, and they have a lot of live parasites. Now, eventually, over time, these parasites will die. If this is a dog, it might get worm. Over time, they will die, and these granulomas will mineralize. Usually, it doesn't cause any problem, but certain times, if there's a severe infection, obviously, as they die and they mineralize, there's an inflammatory reaction to them. You can get airway obstruction. Crenosoma vulpis, one of a number of lungworms of dogs. You also have Philoroides, Hirthi, and Milksai, which we don't see very much, but those live down within the alveoli, and they won't be confused with this. And then, of course, you have the heartworms of the dog, Filaria, and Angistrongylus fascicorum, which don't really cause too many problems here. So Crenosoma vulpis, great lesion, great little granulomas, great little live worms in these. If we got a little closer, you would see the walls through this sort of capsule of fibrous connective tissue. Only have 3 more left in this test, and this is tissue from a horse. Can you give me a morphologic diagnosis and an associated clinical pathologic finding? Okay, time's up. This is sort of a tough one. I've always told the residents, if you're looking at the stomach of a horse and it looks like absolute crap, and it smells. This is probably squamous cell carcinoma. And horses get squamous cell carcinoma. They're the clue that you're in the stomach or the bots. Bots didn't cause this, okay? Bots are on the glandular mucosa attachment. This is all in the squamous part of the stomach above the margo plicatus, which goes right down through here. It just looks absolutely terrible. It should be nice and white and flat. And this one is very corrugated. And so this is squamous cell carcinoma, not that uncommon in old horses. This horse is probably very thin. It might have some effusion in its abdomen. These particular neoplasms look really ugly because the body hates keratin. And you have keratin within this. This is keratinizing squamous epithelium. The body is going to mount an inflammatory response, which actually accentuates the ulceration of this particular neoplasm. You have a lot of neutrophils in it. These neoplasms can either metastasize the local lymph nodes, or they can rupture through and they can explant along the serosa of the stomach and other organs. The clinical pathologic abnormality that I want you to think about is hypercalcemia. It is one of the causes of hypercalcemia of malignancy in the horse. And so these horses may have a very elevated calcium, up to 15 or 16. So squamous cell carcinoma in the horse, in the stomach, got to remember that one. This is tissue from a rabbit, slide 9. Can you give me a morphologic diagnosis? Okay, time's up. We're obviously, I shouldn't say obviously, because some of you are just starting your training and watching these videos. So we are looking at the bicornuate uterus of the rabbit. This is an older rabbit. It's probably one of the exotic breeds. It's probably 4 or 5 years of age, and there's a large mass. And rabbits are prone to developing uterine adenocarcinomas as they get old, and the amount of progesterone and estrogen goes out of balance during the aging process. This is the time that they will develop these neoplasms. Hasn't been definitively proven that's it, but it seems to temporarily be developed in that time. These will metastasize often to the lungs. They are often multiple on both sides. This one seems to be focal. They are often hemorrhagic. Uterine carcinoma in older does is a thing in rabbits. I think that pretty much any older female rabbit could get this, but some of the pet breeds seem to be a little bit more predisposed than wild types. And finally, slide number 10 is tissue from a dog. How about a morphologic diagnosis and a cause? Well, time's up on this classic lesion that's associated with canine distemper infection. And what you're looking at are areas of enamel hypoplasia. This generally happens in utero. It's not something that you'll see if an animal is infected after it's born. It's during development of the teeth. And the virus will infect the enamel organ in the developing feet and cause necrosis of cells of the stratum intermedium of the enamel organ. And during that period, the developing tooth is not covered with enamel. Now, if the animal recovers, the mother clears the infection, then the developing teeth will reestablish that enamel organ, and you will have enamel put down, usually around the crown. And most of these lesions are sort of deep. So this is multifocal enamel hypoplasia associated with canine distemper infection in utero. Obviously, there may be some other changes that goes on. You may have bone changes. You may have a number of things going on during the development of the fetus if it has a viral infection. This lesion, if I saw it in ruminants, I might think about fluorosis or fluoride toxicity, but in this dog, it's pretty classic. For those of you who suggested this might be tetracycline toxicity, that would cause a diffuse brownish discoloration, but usually does not cause significant enamel defects. There are people who say, well, it's not really just canine distemper. Any viral infection or any high fever in the dam during this period of development, this very short window, will cause this. I'm not sure about that, but I do know that it has been largely associated with canine distemper. Well, that's it for Gross Challenge number 58. I hope that everyone is staying indoors, being safe, staying away from this bad virus. I am hopeful that we will all be back out in the sunshine again, but until then, I will continue to put out these Gross Bath challenges. I hope that you are enjoying them. It certainly is a highlight of my day being able to share these pictures, which I have collected from so many great pathologists over the years, with a new generation or two of veterinary pathologists. With that, I'm going to sign off here, and I'll see you tomorrow for another Gross Bath Challenge.